Center for Disease Control, the NCDC, has announced 164 new cases in 24 hours from 14 states and the FCT. It saw Lagos leading the pack with 64 cases, followed by the FCT, which had 26. Enugu 20, Kaduna 11, same with Oyo. Plateau had 8, Ondo 7, Anambra 4, Nasarawa, Oshun had 3 each, Ebonyi, Imo 2, Benue, Katsina, and Ogun had 1 case each. More people also recovered from the virus, 208 in the last 24 hours in 10 states, including the FCT. Enugu discharged the highest at over 100 patients, that's 103 to be specific. Plateau had 52, Rivers 23. The FCT and Imo each discharged 10 patients. Ekiti and Niger discharged 3, Ebonyi 2, and Katsina and Oshun discharged 1 patient each. The country recorded no deaths in the last 24 hours, so the number remains at 1,115, a case fatality ratio of 1.8%. Let's talk to Dr. Abi Abraham, consultant public health physician, who's joining us via Skype from Lekki. Good evening, Dr. Abraham. Thank you for your time this evening.
Good evening. It's really nice to be here.
Last time you were here, we were talking about schools. At that time, many of them had not, in fact, reopened in terms of those that had boarding facilities. But this week, yesterday, today, and for much of this week, a number of them will or have been reopening right across the country. Today we saw a number of reports from the northern parts of the country, Zamfara, Niger, Adamawa, and a number of other places. I'm just wondering, do you harbor any fears about schools that have boarding facilities, in which case the children don't come and go back home? Once they are there, and the parents go away, they are left in the hands of the school administrators.
You know, I think this is plus and minus, because there are 2 ways to look at this. The first way you can look at this is that you have a contained population, and they are there 24 hours of the day. And as long as they follow instructions and they follow all the social distancing and infection prevention control measures, they will be safe. But on the other hand, you have a situation where you are in a contained environment, and any little infection can spread the virus like wildfire. So the only thing I would say is that if in boarding houses, there needs to be further, actually more rigorous infection control, even more so than even in the day schools. I mean, it is obvious that the students are there, so they can't go and get infected as they go out. And like we discussed last time, you know, with the young people, sometimes they throw caution to the winds and they don't wear their masks and things like that. So that can't happen, because there should be a rigorous policy and procedure. But again, in the boarding schools, there cannot be any relaxation, because this is a community setting and it's a closed setting. And they are actually closer to themselves than if they were in the day school. So I think it's a plus and minus on that level, really.
Let me elaborate a bit further on the environment in which all of this is taking place. Many of these schools themselves are situated in communities, and a lot of the workers who work in the schools, either as cleaners, as security men, and other support staff outside of the main teachers, go and come from this neighboring communities. So it's not exactly a protective bubble, is it?
No, it isn't. I fully agree with that.
In that case, what do we do? How does one ensure that this doesn't become a bigger problem?
Well, in the end, it's going to have to be education of the staff that are coming in, and also the students, because, like even in day schools and all that, we have staff who go in and out and who could also be vectors of infection. So I think it has been impressed upon us that the staff have gone through rigorous training. Not all the institutions, but at least some of them have gone through a lot of training. I'm party to some of the training that they have been through, and it is rigorous for some of them. I can't vouch for everyone. So I should expect that the staff who are going in and out are also being rigorously looked at, examined, and it is ensured that they do not act as vectors of infection. I would not, obviously there's the big thing about should we be testing them or should we not be testing them? We are still at the point where we are not really supposed to, in a sense, test the staff. So again, it all has to be rigorous infection procedure control, but the staff have to, they really, really have to watch it very, very closely.
You talked about infection prevention and control. There were those when the first set of schools were to reopen, I believe that would now be about 2 months or 3 months ago, when they were talking about sitting for the WAEC exams. And there was all this controversy over whether or not they should test each and every student for COVID-19 before they get into the school, and then submit them for regular testing subsequently, so that the kind of epidemic or outbreak that you talked about that could easily happen could be quickly found out and contained before it became a problem. Do you think that is a good idea, especially now that more and more of the institutions are reopening?
It is a good idea, but I don't think it is practical. I don't think it is sustainable. If I was going to suggest, I would say if the children could have a COVID test before they went into the boarding school, one off, I think that will be a good idea. But again, we'll have to look at the practicality of it. But I do know that there are some, private schools, that's on the private sector, who are students who are being asked to do the COVID test. But to test the children rigorously every 2 weeks is not really even scientific, because of the incubation period of the virus, and also the fact that there are times when it is 3 to 14 days, and so to keep testing and retesting will not really make practical sense. So I'm not sure that's going to be on the ball. I don't even think it's affordable. I'm not really aware it is being done anywhere in the world in the sense that you are describing. So again, we're back to, until we get this vaccine, we are still back to really this protocols that we just have to be rigidly looking at. Again, the children themselves don't. They usually either don't carry the virus or they are asymptomatic. So the real risk with them is the fact that they could be vectors of the infection, and they could, even pass it on to the adults. So sometimes the adults who are looking after them are the target as opposed to the children. And so the adults themselves really, really have to watch it.
After the cameras have gone, I mean, every school you go to now expects that there'll be 1 or 2 TV cameras to come and look at how they reopen. But after the novelty of reopening has worn off and it is now time to get on with the job of educating the students and the cameras have gone away, do you harbor the fear that some of them may slacken?
I think that's always going to be on the cards, isn't it? The fact that there might be that slackness. But I do know that there are inspectors who actually have been asked to go in periodically. They also have some form of external monitoring of their systems. And so I think the government, at least I know about the state governments, they have put a little bit of checks and balances in place to ensure that that slackness does not happen. So it is the usual human tendency to just fall a bit by the wayside once the novelty has worn off. But because of the external monitoring that is some of which is going on, and even the internal monitoring and the inspection visits, hopefully that will continue from the state offices. We're just hoping that that would help them to keep the policies and protocols. I think obviously the state could also put in again checks and balances to the effect that there might be some negative measures that might be meted against them if they do not follow the strict guidelines.
Are you surprised by the fact that about 46, I think the number was, of the test kits, the rapid test kits that were submitted for validation by a number of manufacturers and other proponents of those rapid test kits, the Medical Lab Science Council said none of them met the criteria for accuracy or sensitivity. Are you surprised?
Yeah. No, I'm not. I'm not really surprised because the type of testing that we're not doing the PCR testing, isn't it? We're going for the antibody testing, which always will slack when it comes to sensitivity. And even specificity and even sensitivity. With sensitivity, that is the number of tests that are truly positive. And with specificity, it is the number that are truly negative. If you think about how the virus itself works, by the time you are getting to the antibody level and trying to gauge the antibody reaction, you get to a stage where it gets a little bit muddled because, like we've said before, the incubation period is 2 to 14 days. So when does the person actually get antibodies? It's difficult to tell. We're really in early stages with this COVID thing. A lot of these tests, like you probably would know because you're quite wide with your knowledge. A lot of these tests take 15 years to develop, including the vaccines. But we're just pushing now because of the enormity of the problem and the emergency of the problem. We're pushing on all fronts. So I'm not really surprised. The only thing I would say to the researchers is to keep going. I should think that once they do not give up, and hopefully they will have adequate funding because these things also cost money. Hopefully they have enough funding to go with this. Hopefully we should get some reasonable tests soon. Well, I don't know about soon, but we should get some tests anyway. Hopefully it should be soon.
The other thing here is that as part of the reopening process, we reopened our international borders and flights. And I've asked some of your colleagues about this. The first question, of course, relating to that is that, do you harbor the fear that what we've been dealing with so far, as I'm told, is a particular strain of COVID-19? Do you harbor the fear that with this reopening, already, the PTF, the Presidential Task Force on COVID-19, says that 22 of the people who have come in so far have tested positive, even though they didn't talk about this aspect of it. But do you have a fear that we could then be dealing with different strains of COVID-19 from the ones that we have dealt with so far?
You see, I think the African experience is a real enigma and a myth, even to the Western world. Despite these so-called strains and strains, we find out that, and I know there are quite a few strains, we find out that there's just something really interesting happening in Africa, in sub-Saharan Africa. The level of infection, no matter what strains they talk about, is just lower. Like you quoted the death rate today, 1,115. It is terrible. Every death is devastating. But compared, 1.8% is our ratio. Compared to other parts of the world, it is really, really, really good. And so I am not fearful of the strains because I think whatever is protecting Africa, which the world still doesn't know, the researchers are working on, whether it's the vitamin D, whether it's the genetic makeup, whether it's the malaria, whatever it is that is protecting Africa, at least sub-Saharan Africa. I'm hoping that we will continue this way. Like many strains have entered, even when the NIMR did their initial test. There were quite a few strains that they isolated. So it's difficult to tell, but I'm also hopeful that, like I say, whether it's the sun, whatever it is that is pushing this virus a little bit far from us, that is the edge of the virus, will continue to hold. We're also in Africa, at least in Nigeria, moving into the dry season, which is an excellent time because, obviously we know that it's not as heat is quite a good thing for it. So I think we have many factors here, more than actually the fact that there are different strains that are coming in. And I think, but again, I will keep saying it, we just still have to be careful. We just cannot let down our guard at all. And kudos to those who've managed to isolate the numbers of people who came in with COVID.
The vulnerabilities that we have, one or many would have expected that they would reflect in the amount of resources that will now be pouring into our health sector facilities, personnel, and all the other things. And that was reflected. The budget submitted by the president, the budget proposal submitted by the president had a multi-fold increase in the allocation to the health sector. But there are those that fear that this is not going to go where it's supposed to, and it's going to be swallowed up by overheads and recurrent expenditure. If you were to be told, or if you were to be told to identify some key areas where that should go, where would you say they should focus on, given our experience in the last 7 months?
Well, I would say number one, it needs to go into primary care. Because primary care really is the bedrock of society, and it also needs to go into research. I would look at those two areas very, very carefully because research is something that needs to be really undertaken so that we will get ahead of this virus. So if we're talking of budgets, the budgeting and for COVID, and I would say research, I would say primary care, and I would also say equipment and staffing and training. Those are the things I would really talk about, because if we had the proper primary care centers, if they were adequately resourced, we will catch this virus even at the grassroots. We don't need to be going into obviously secondary and tertiary care to sort it out, because prevention is possibly the only cure sometimes. And so I would really be looking at primary care. I will be looking at research.
One of the things you mentioned there is grassroots. The rural areas have largely been left out of the conversation about COVID-19, whether it's compliance or about training or about developments that have to do with COVID-19. Some would argue that that's where our next problem is going to arise. What do you think?
That is a really difficult one. I think one thing the rural areas have in their advantage is the open spaces. You know that in the rural areas, there are lots of spaces. People do a lot of outdoors and all that. So I think that helps. But on the other hand, yeah, it is possible because, like I say, there hasn't been lots of education going on. All the resources haven't really been shared in those areas, and so it is somewhere really to watch out for. Definitely, especially with regards to the resources, the human resources, the capital resources, the financial resources. It is somewhere to look out for, definitely, the rural areas and the grassroots. And I think resources really need to be allocated even on that level.
Dr. Abi Abraham, it's been a real pleasure speaking with you this evening. Thank you so much for your time.
You're welcome. Thank you very much.
Let's go outside our shores now to the United Kingdom, where the Labour leader, Keir Starmer, has called for a short lockdown in England of 2 or 3 weeks to help bring down the rising rate of COVID-19. His call comes as members of Parliament approved the legislation to write a new 3-tier system for COVID-19 restrictions in England into law, with every area of the country classified as being medium, high or very high alert, suggested by Prime Minister Boris Johnson in Parliament on Monday.